I was diagnosed when I was 12.
I was diagnosed at birth.
I was 6 when I was diagnosed.
I was 16 and 8 months when I was diagnosed.
My diagnosis is type 1 von Willebrand and a severe non-specific platelet aggregation defect.
I have von Willebrand disease, type 1.
I have type 2B von Willebrand's.
I was diagnosed with von Willebrand disease type 2M.
Diagnosis is von Willebrand's type 3 severe.
Essentially, my platelets don't send the signals they need to get that chain reaction kicked off for forming a platelet plug, so I can't form the beginning stages of a clot properly.
I've kind of fluctuated between mild and moderate through different stages of my life. Right now, I'm currently mild.
It's type 3. It's obviously the most severe of the von Willebrands and most rare.
Excessive, frequent, and prolonged periods. Uncontrollable and unpredictable nosebleeds, pain and bruising, complications with births, social isolation, generations undiagnosed. Von Willebrand disease, or VWD, is a genetic disorder caused by missing or defective clotting proteins and named after Erik von Willebrand, the Finnish researcher who discovered the disorder. It can be painful, confusing, frustrating, and isolating. The symptoms and effects of those symptoms are internal and external, and it affects up to 1 in 100 people, making it the single most common bleeding disorder in humans. So why have so few people heard of von Willebrand disease, or VWD? And on a related and more important note, why are so few people diagnosed with it? Research has shown that 90%, or 9 in 10 people with VWD, have not been diagnosed. And for the 1 in 10 who are diagnosed, the average time to diagnosis is 16 years. You heard that correctly. It is believed that the average time from symptoms of von Willebrand disease to diagnosis of von Willebrand disease is 16 years. So we have to ask, is this a crisis? To answer that question, we're going to take you to meet VWD carriers and clinicians around the country and the world. We're going to hear their stories, their struggles, their victories, and we're going to attempt to answer the biggest questions about von Willebrand disease. But before we get to the biggest question of them all, are we in the midst of a healthcare crisis when it comes to the undiagnosed von Willebrand population? Let's start with something smaller, more specific, and tangible. A nosebleed that won't stop, a bruise that won't go away, a joint ache that throbs for days, a heavy, painful period.
I had had symptoms my entire life, anywhere from nosebleeds to bruising, weird joint pain that, of course, everyone was like, oh, you're too young to have that. I'm Kira Bechet. I'm 18 years old. I live in Colorado. The big kicker for me was when I hit puberty and my periods were horrendous, and it was something we had in the family, and it was just chalked up to, oh, it's just genetics.
That suite of symptoms is not uncommon, and several of our guests from around the world share a similar story, including,
it was something we had in the family, and it was just chalked up to, oh, it's just genetics.
In other words, the message is often, oh, well, there's nothing we can do about this. This is Andrea.
My daughter, at 3 weeks old, she had a nosebleed, so we brought her to the emergency room, and then we were told that there's nothing to worry about. She was just anemic. And I told the doctor about the history of my family, that there's hemophilia A in my father's family, and my mom died of bleeding. And they said, oh, she cannot be a bleeder because she's a girl. She grew up having all those bruises and nosebleeds, and she would vomit blood occasionally. And I was just so frustrated when she was around 7 or 8 years old, because she would nosebleed every day. And I really don't think that was normal.
When she was 6 months old, she went in for her well child check, and her head circumference was off the charts. I'm Carrie. I'm 34 years old, and my daughter is Allie, and we are from Cannon Falls, Minnesota. We brought her to our local children's hospital to have like an MRI and CAT scan, and they found that she had a subdural bleed.
A subdural bleed is scary for all the obvious reasons. There's bleeding between the brain and the skull, and in infants and young children, it's often thought of as a symptom of child abuse. Even Medline Plus, the National Institute of Health's online medical encyclopedia, includes the following line in their description of subdural hematomas. In infants and young children, a subdural hematoma may occur after child abuse. There's no mention anywhere on the page of the possibility of the bleed being the result of a bleeding disorder. So it stands to reason that it's probably not commonly taught as a potential symptom of a serious bleeding disorder.
Any bleed for unknown reasons, you obviously have to look at child protection issues. Being that Allie was 6 months old, exclusively breastfed, was with me pretty much 100% of the time, I really knew that nothing had ever happened to her in that regard. So I knew immediately something else is wrong with Allie.
You have an infant with a brain bleed, maybe bruises. You're terrified. You're being asked about child abuse of all things, and all you want is answers. But often, the answers don't come for months or even years.
As a parent, I definitely had to advocate for what else could cause a subdural bleed in a child other than, because this is sometimes associated with shaken baby syndrome. What else could cause this? And there's genetics, Ehlers-Danlos disorder, connective tissue issue, and then the bleeding disorder. Be worried about those families that, are, undiagnosed and they're having these issues, or, like us, we had to go to the child protection system. It's like, this is a medical disorder that may present as abuse, and if you're not able to find the medical reasoning, and think of all those families that are, going through something, really horrific, that kind of breaks my heart,
As a person affected by von Willebrand disease, or as a person suffering heavy bleeding who thinks they may be affected by von Willebrand disease, it's important to know that you are not alone. While von Willebrand disease is the most common hereditary bleeding disorder, it often goes unrecognized. People with von Willebrand disease can often feel isolated, and that the impact of their condition on their quality of life is minimized or dismissed. This is why Shire is committed to bringing greater awareness to this often overlooked condition. They understand that you are more than just your bleed. They see you, they hear you, and they are committed to serving you. To learn more, visit beyondthebleed.com.
Not every story of an undiagnosed infant or child is this fraught, but it's not uncommon. This is Carrie again.
I'm a social worker in history, so I really understood that the child protection piece of it and the police investigation that it had to be done based off of, this child with a bleed in their head, and for no known reason. And she would be looked at for other signs of child abuse. So they would do a full body bone scan, and then also with shaken baby, a lot of times your retinas can be torn or have a hemorrhage behind your eyes. So her eyes were looked at. And of course then with the police and child protection, they would look at our family and our legal history and all those things. Nothing was found on her bone scans. Nothing was found in her eyes. So there was no other, reasons physically to suspect abuse.
One other interesting note here. There were significant clues much earlier that Allie had a bleeding disorder.
When she was born, she was having a difficult time during labor, and labor had to be slowed down because she was just having a really difficult time. And when she was coming out, she was not facing the right way. So the doctor went in and had to turn her. And when she came out, her whole face was just so bruised.
Hearing some of these stories, it can feel like the system is truly broken. This is Jenna.
When I wasn't at school, all the time I was spent on friends' properties, and every single person up there was covered in bruises and scrapes and bumps, and like all the kids, all the adults, was just, because everyone was out doing physical stuff all the time. So even though I probably noticed my bruising was, a bit worse and lasted a bit longer than everyone else's, it wasn't like that out of place. My name is Jenna. I'm 31. I live in Tasmania, Australia. It wasn't until my periods really started at 14 that we kind of went, that's not normal at all.
That's not normal. This sentence, these 3 words seem to pop up over and over again. People with VWD often know something is wrong, but can't quite articulate it, or worse, can't convince a doctor to identify it.
I had 2 years of excessively severe periods in every sense that you could think of, from the amount of blood I was losing, the length of them, and we're talking months here, not weeks, the amount of pain I had, I was regularly passing out. Yeah, every single symptom you could imagine, I've had it pretty bad. Sorry.
My mom was diagnosed in her 20s while she was serving in the military.
My name's Michelle. I'm 24
34. I currently live in Rochester, Michigan. I think that diagnosis has really given me a different story than a lot of people with von Willebrand's because I've been lucky to know my entire life that I've had this disorder.
Like we said before, the average time from symptoms to diagnosis is around 16 years. Michelle is one of the lucky folks who was diagnosed essentially at birth. In her case, a family history worked for her, not against, because her mom was diagnosed. Once that happens, doctors often know to test offspring and family members moving forward. That diagnosis and the lifetime of healthcare and awareness that comes with it can dramatically improve someone's quality of life.
I also have 2 sisters with von Willebrand's type 1, a half-brother with it, and my boyfriend also has type 1. It's really interesting because I've kind of grown up with this built-in support network of all these people who've had it. So I've never really not grown up not knowing people with a bleeding disorder.
One of the big misconceptions about von Willebrand disease is that it's a female disorder or female disease. We'll talk more about this in the next 2 episodes, but it's important to note that VWD affects males as well.
My mother is, which actually she didn't even know until I was diagnosed. So the only family history that we found so far is my mother's a carrier. She has type 2.
Christopher Sariva from Acushnet, Massachusetts. I am 31.
It's type 3. It's obviously the most severe. It's certainly probably the most restrictive of von Willebrand's. Irregularities can occur, especially in a male.
There are a few theories on why men are diagnosed less frequently than women. One of the reasons is that menstrual cycles provide constant monthly symptoms. But believe it or not, that also means that month after month, year after year, many women are told that heavy periods just run in the family, not much we can do about it. And that's just genetics. In other words, the same recurring symptoms that should lead to a diagnosis in women are used in many cases to dismiss the need for serious examination.
And even after my mom was diagnosed in her 20s, she went through a lot of the same things that women who were undiagnosed went through.
This is Michelle again.
For instance, when she was having my younger sister in 93, they refused to give her clotting medication when she was giving birth. And she almost bled to death because the doctors kept saying, well, a woman can't have a bleeding disorder. You're lying to us, so we're not going to give you that medication. And she's like, no, I have a diagnosis. Even having a diagnosis, she struggled throughout the 90s when it was still kind of a taboo subject to get treatment for the things that she needed, including treatment for her periods. And she ended up, when I was really young, having a hysterectomy because she just could not manage her symptoms of her periods.
To make matters worse, not only are people with von Willebrand often dismissed before diagnosis, but sometimes even a proper diagnosis can create problems due to a lack of awareness about the disease.
My mom is such a more interesting story, I think, than I do. I give her so much credit. So she grew up not knowing she had this. And she kind of has a lot of the horror stories that many women have. She would go to school and start her period and have stains on her pants, and her teachers would think that she was hurting herself. Or they would think that her parents were abusing her. And she's like, no, I don't know why I'm bleeding this much. I don't know why I'm getting bloody noses. She was on the swim team, and she'd get bloody noses during swim team practice, and she wouldn't know why she was getting them. So she joined the military. While she was serving, she had a dental procedure done, and the dentist said, hey, I think you might have this thing because you're not clotting. And so I think you might have this thing. And my mom was like, that's weird. And so they diagnosed her. And the military actually at the time had told my mom, we think you're lying to us. We think you knew you had this when you joined. So we're going to discharge you. And so she was discharged from the military because of her diagnosis, because at the time they thought that she knew she had it going in. She's like, I've never heard of this thing. Like, I don't know what you're talking about. She ended up later going to fight to get her VA benefits because she was discharged without her benefits because they were convinced that she knew she had von Willebrand's disease going into the military, and that's actually when she was diagnosed.
In other words, she was doubly penalized for the medical community's lack of knowledge. First living with the incredible challenges of VWD, then for being diagnosed by people who didn't understand what it meant to have lived with VWD for those 20 plus years. And you would think because her mom's diagnosis was finally clear that she would have an easier, more managed life experience with VWD. But that's where we run into systemic problems with ignoring or not understanding the disease. How is the mother supposed to prepare the daughter when doctors never prepared the mother? This is Dr. Robert Sidonio.
When I started seeing patients in the clinic, and particularly in the workup clinic where we'd see patients with bleeding symptoms and work them up for a potential bleeding disorder. The thing that struck me was that we were pretty decent at diagnosing patients with von Willebrand disease, since it is much more common than hemophilia. But I felt like most of the time we often would approach them, we would diagnose them with von Willebrand disease, and then we would say, okay, well, we've diagnosed you and we'll see you in 6 to 12 months. We didn't do a very good job, particularly with the teenage girls, because I would see teenage girls, after teenage girl coming in with horrible heavy periods, some requiring transfusions, and I would see the poor quality of life that was associated with it, missing a lot of school and just generally feeling pretty bad. And so I just felt like this was an area that was not as explored, and I always wondered why we didn't do a better job of communicating with our adolescent colleagues and our GYN colleagues. And then I found out that most GYNs don't feel comfortable seeing teenage girls under the age of 16. And with the average age of the first period being around 10 to 11, it left sort of a group of teenage girls without any adequate care. So I was drawn to that because I felt like this was an area of need.
As a person affected by von Willebrand disease, or a person suffering heavy bleeding who thinks they may be affected by von Willebrand disease, it's important to know that you are not alone. Shire is committed to supporting you. They are passionate about providing you, the von Willebrand disease community, with the information and resources you need so you can get the help you deserve. You have a voice. They want to help you raise it. Be seen, be heard. To learn more about how you can manage your condition, visit beyondthebleed.com.
We had to go to a lot of different doctors because my first period of my life was over a month long.
This is Michelle again.
I was the first of us 3 girls to get my period. And we ended up going to, I remember, OBGYNs and various different doctors to try to figure out what we could do because I was becoming super anemic, very lethargic. And it was a terrible quality of life for that first couple of months with my period. And so I just remember being a 9-year-old girl sitting in an OBGYN's office, being scared out of my mind, surrounded by older women, pregnant women, wondering what's happening with my life. And I ended up going on the pill at age 9 to get my periods under control.
You heard that correctly. At age 9, Michelle was put on birth control in order to get her heavy periods under control. We'll talk more about this in the next episodes, but the pill is actually a common tool for bringing menorrhagia and heavy periods under some sort of control.
And that worked pretty well up until age 16.
This is Carrie again.
All of my information really was just from me Googling it. As I have done more research, it's like what you said, that everybody's different and everyone has different reactions. And when I look at my father-in-law and my husband and my stepdaughter and my children, they all have different levels of reactions, that's for sure.
Which brings us to another challenge. How can doctors diagnose something with so many variations? Variations in symptoms, variations in genetic makeups, and variations in the disease itself.
I was diagnosed in 86, right? So in 86, there wasn't much information available to people or to physicians even regarding my conditions. Found myself kind of being, how's the best way to put this, but like a guinea pig for a lot of things, and just, kind of a lot of physicians hearing firsts when it came to my experience with VWD.
It's so difficult to test. When discussing with my hematologist, he says it's one of the hardest diagnosis to test because your levels can change in a moment. You're only taking a snapshot of what's going on in your body at that one moment, and it could change 2 hours later. It depends on how much you ate that day. It could depend on your stress level. So many different variables that happen with von Willebrand's that they forget that, this happened this day, and it adds up to there is something going on, and they need to get better at the testing. There is the blood test, there is the clotting time test, but the tests are still so inaccurate that it's very difficult to get that diagnosed young.
Testing procedures for VWD are complicated, so for the purpose of this series, we're not going to go into depth on the actual procedures for testing for VWD. That's another important question for your doctor or care team. That being said, several of our participants relayed that one of the more frustrating aspects of living with VWD pre-diagnosis is this idea relayed from their doctors, in many cases over years of symptoms, the tons of variables in the human body, in the tests, and in the types of VWD make testing and diagnosis difficult. Hearing these stories, though, it starts to feel like the clues are all around us.
My mother died of bleeding during a biopsy operation in 1988.
This is Andrea again.
We knew that bleeding runs in my family. Her family has bleeding. My father's family also has hemophilia A. So we knew early on that we have bleeding in our family. My son stayed in the hospital for almost a month. He was in the neonatal intensive care unit. He had cardiac arrest when he was 3 days old, but he survived, and now he's 22 years old. That time was such a difficult time for me. If people would ask me what's your most difficult time, that would be it. Looking at your son on the brink of death. He was attached to so many machines, and we were not sure if he would survive it. But and I guess it's all because, I have a bleeding disorder that was not managed properly.
How do these chains of events not add up to a diagnosis? We've been asking ourselves some difficult questions here. Namely, are we in the community failing people with VWD? Do hematologists assign more need to their cancer patients and patients with hemophilia because those diseases feel more outwardly medically severe? Do people take the potential for VWD less seriously because it affects women? And finally, is this a crisis? We don't want to sound alarmist. These are obviously really, really tough questions, and we're not pretending to have the answers. But one thing is for sure. In one of the wealthiest countries on Earth, with access to the best tools for diagnosis and the best medicine in the world, we can do better.
With von Willebrand disease, it's important to know that you are not alone. There are many people just like you who are impacted by the emotional and physical consequences of von Willebrand disease. Whether you are newly diagnosed or have been living with von Willebrand disease for some time, being able to talk to someone who understands what you are going through can be very helpful. Joining a bleeding disorders community and sharing your story may also help others who may share the same questions or concerns. Be seen, be heard, get involved. To find out more about how to join a community of people just like you, visit beyondthebleed.com.
Next on our BloodLine series, von Willebrand Disease, Diagnosis, Treatment, and Life, Episode 2 of 3. We look at after the diagnosis. What comes next? Von Willebrand Disease, Diagnosis, Treatment, and Life is made possible by Shire. Shire has been supportive of our efforts to create educational content around VWD, and we are truly grateful. This episode is a Believe Limited production produced by Patrick James Lynch, Ryan Gielen, and Josh Davis. Hosted by me, Jennifer Thomas. Written by Ryan Gielen. Edited by Josh Davis. Mixed by Michael Capuano at Iceman Sound. We'd like to thank our guests for sharing their stories. Brittany Vieira, Kira Boucher, Michelle Cecil, Amber Federizo, Andrea Trinidad Chavez, Chris Saraiva, Dr. Robert Sidonio, Jenna Lavelle, Carrie Levesque, Zuiho Taniguchi. Thank you for opening your lives to our show and sharing your stories with community members. Your generosity and openness will encourage others to examine their symptoms, speak with their doctor, better understand VWD and the community around it, and made us feel a little more connected. Please follow BloodStream Media on Facebook and Twitter, and visit bloodlinepod.com for updates and to learn more about our long-form educational podcasts.